Tonight, we're thrilled to have a special treat from a physical therapist named Jonathan Parr, who started his own physical therapy multi-location practice called PARR PT. And he's in Texas. And I'm going to let him tell you a little bit about what he's doing. But interestingly enough, hopefully we can get him to tell us about the time that he's been, I believe it's a 6-time American Ninja Warrior finalist. So before we get to the fun PT stuff, if you want to share your fame, if not, you know, we can go ahead.
Yeah, I'll keep it short. Uh, no, I was very fortunate to compete on American Ninja Warrior for 6 years and got a chance to compete in the finals. And overall, it was such an amazing experience, such a test of mental strength, physical strength, emotional strength, and actually, there's a lot that I learned from competing that I apply actually to programs and progressions that I do today with a lot of clients. So although it was very extreme, it really did help me construct a lot of the programming that I do now. So I'm very grateful for that.
Yeah, sorry, I kind of put you on the spot there. We definitely want to hear about your professional expertise. And I know you have a little bit of a background in your personal life where someone was impacted by an illness that sort of motivated you to start down this. So I can go ahead and hand it over to you and let you kind of tell your story and talk about what you want to talk about. And then when we're at the end, I'll be happy to facilitate Q&A from anyone in the audience. So if you would, you can hold your question till the end or put it in the chat and I will get to it when we're at the Q&A session. So take it away, Jonathan.
Yeah, thank you. So my name is Jonathan Parr, physical therapist for December 18th will be 15 years now. So I've had quite a bit of experience. And really, how I got into PT, a story that I share a lot is my sister ended up getting a chronic illness that was very rare when she was very young, and I'm younger than her. So seeing that process and seeing things that are very similar to what I see today in this chronic, I would just more so say EDS, POTS, connective tissue disorders, where there's a lot of doctors who may not be familiar with that condition. You find yourself bouncing around to different places, searching for a diagnosis or some sort of answer to what it is that's going on. And my sister dealt with the same thing, having to go through that young, I believe she was 21 years old. And during that process, seeing not only that part of it, of the need of a specialist, but also looking into what it took to get her back to where she is today, which is, I'm grateful that she's able to walk and talk and eat by herself, and she has a daughter, those kind of things, like things that matter most. And the because of the rehab component and how debilitating some of these conditions are, depending on the type and severity, in addition to finding resources, that's really how I dedicated my career to it. I ended up just getting a patient one day at a facility where my background is actually neurological, so brain injury, stroke, spinal cord injuries. I did it for the first year and a half, and when I went to this facility, they had people who had EDS, and I didn't know what it was. And so once I had my first patient, it really reminded me of situations that were very similar, although they were completely different diagnoses. It reminded me of that. And so one thing that's actually very interesting, I still have never worked with anyone with my sister's condition today, and it's been 15 years. But the blessing was that I got to work with another condition that was need, which is hypermobility and connective tissue. And once I saw that link, I started to be more drawn into that condition as a way to essentially be an advocate and a way to, to help a community that is much larger than what I thought back then, 15 years ago. So again, 15 years later, um, working with chronic illness, EDS, POTS, and actually very complex conditions. So I have a pretty big background with pediatrics, with geriatrics. So I've had my foot in a lot of different areas, which I feel like has allowed me to really understand the body as a whole from pediatric all the way to geriatric. Oh, I don't hear you.
Sorry, I'm talking with the mute on. Thank you so much. Um, I know one of the things that you're going to share with us tonight is your approach, and I know that it has a, neurological, muscular, connection. Tell us a little bit about your, spine and neurological background and ultimately how you got to sort of the research and the treatment that you're doing with patients today.
Well, like I said, I was in an inpatient facility, primarily working with brain injury, spinal cord injury, strokes, anostic brain injuries, Parkinson's, MS. It was just a variety of very, very involved conditions. And one of the things that we learn as therapists is because there's usually some sort of paralysis on one side or even both sides, that as therapists, we're taught on how to retrain the brain as a way to get movement back in that area. And there's a lot of other neurological concepts that I won't really bore y'all with, but it's that's the idea and the approach that we have towards that population. Now, when it comes to connective tissue disorders or various chronic illnesses, there is a big component that's associated with that as well. Is not so much that person may or may not have had some head trauma, but in the case that there hasn't been a head trauma, there's still some sort of disconnect between the brain and the body. And that's because that's my background. That was one of the things I noticed from the beginning of these patients that lacked a lot of awareness, spatial awareness. They would chronically get injured, not so much of the instability, that was a component, but they had such poor spatial awareness that um, they weren't reacting with the protective responses needed to prevent an injury. You know, when you think about, there's times where if you slip, you actually will put your foot out as a protective response, right, to catch yourself from slipping. Those who with poor spatial awareness, that response is delayed, and so by the time they're reaching, they're already on the ground. So there's those kind of neurological concepts that I'm referring to in regards to what we typically will retrain the brain in populations related to more in-depth neurological conditions.
I look
Uh,
forward to hearing more. I'm sorry. Go ahead if you.
but yeah, so because you asked me a little bit more, so the approach that I have is including that major component, right? Is the idea is how can we reconnect the brain to the rest of the body to perform the normal voluntary and involuntary movements that are required for us to live on a day-to-day basis. So I call the three systems approach because I found that there's three systems that tend to be more involved from a fundamental standpoint, which is your vestibular system, so your inner ears. A lot of people know this system for either causing vertigo or dizziness or something like that. But this system plays a huge role in communicating with the brain and the body on spatial orientation, balance reactions, responses, those kind of things. When the other system we're thinking about is the autonomic nervous system. Everyone has heard of it. Everyone knows more related to fight or flight or rest and digest, but that is your internal circuitry that allows you to respond either in a hyper reactive way or in a hypo, meaning it's not reacting much at all, or maybe it's kind of ground zero or in the middle where it's working where what it needs to be. Now, because there's such a close relationship between that autonomic nervous system and the vestibular system, when let's say there's a response of you compensating because of a lack of spatial awareness, there's that increased overload of compensation that may cause an increased sympathetic response. And then that ties into a bunch of other things. Whatever the increased sympathetic response is responsible for, it can cause inflammation, it can cause headaches, it can cause GI issues. Going now into that third system, which is the GI system. Um, a lot of people, I guess nowadays, a lot of the education is based on the vagus nerve and how that controls really our internal system, but there's other components related to the enteric nervous system that's branching of the autonomic nervous system, and how this goes together with the brain and the gut. And when taking PT aside, these three systems are how we function on a day-to-day basis. And as PTs, we're not necessarily trained for all these three systems based on what we have in school. These are all specialties, but the idea is if you were to develop a balance between these three systems, the body sits in a position to where it's not hyperactive and it's not hypoactive, but it's regular or regulated. And when that regulation happens, that allows the body to calm and perform movements without compensation. There's more protective responses. There's all the things that we need to function. We always find that with chronic illness or hypermobility conditions, if there's that disconnect, that's when we start seeing all these uh, other comorbidities related to POTS and dysautonomia and GI issues. Is that that's internal system. Those three systems are not regulated well enough to provide a better like resting environment for your body, which can cause a bunch of other stuff. But that's my approach towards physical therapy when it comes to EDS and POTS and dysautonomia, is that you have to target those systems first before you even think about strength training. Because with strength training, it's very demanding on the body. And if you don't have the systems there with compensation, then that can result in all these other things happening that are not suitable for your body.
It's pretty fascinating. So tell us about, a typical patient is going to come in and see you and say, my arm hurts, or, whatever it is, my hips are out of alignment. Um, and if they're going to go into your program, explain to everyone about, you do the brain scans and you're measuring, the muscle time to you explain it. I can't do it.
Yeah, so the assessment is actually pretty in depth, although we complete it pretty quick. We're covering a lot of different avenues. And the first part is checking posture at rest and seeing what is the body telling you just at rest against gravity. And what people don't realize is that the posture changes with and without gravity. So it's more demanding on the body against gravity than it is without. So it's going to show you a lot of, are you rotated in the shoulders? Is you have one knee popped back and the other one bent? Do you have both knees popped back? Are you arching your back? And so that initial assessment tells us a lot. Okay, what is the body telling you without movement? Now, with movement, it has more of a demand on the body as well, because then you have to apply a lot of the motor control signaling with the movement. So then we look at movement. Okay, where are you compensating? Are you trying to raise your shoulder to your ear as you're trying to raise up your arm? Or can you actually set the shoulder blade and raise it up without raising up your shoulder? So we are looking at every single compensatory strategy that that person is utilizing to see how much is that contributing to maybe an autonomic issue, or how much is that contributing to an actual pain issue. And what you'll find is that there's actually movements that are biomechanically inefficient, that's not actually the area where you're having pain. It's actually on the other side. So the dormant areas of lack of stability and mobility can actually cause pain on the other side. So when I'm listening, of course we listen to where the pain is. My concern is not where the pain is, because the pain is a secondary issue to a primary issue. What's the primary issue? Is it biomechanical? Is it compensation? Is it lack of spatial awareness? And we have to see all these systems are working together and connecting, trying to make the body move. So during this assessment, we're piecing out posture standing still, posture with movement, balance, inner ear function, visceral restriction, so meaning the lining across the abdomen. Is there any sort of tightness or fast restrictions that possibly not allowing movement, maybe on one side, maybe you have more mobility on one side than the other? Well, guess what? If there's a tension, that might even shift the position of the organs that might be underneath, depending on the fascial restrictions below. It might just not so much pull one side to another, but it can be enough to cause something that might cause other compensation. Checking hip stability and shoulder stability. There's a lot of other muscles that can be tested in PT. We check the ones that are basically at the shoulder and the hip, as those are the ones that have the most movement out of the joints in the body, as well as those are the ones that are used more for activities of daily living, like functional movements. Once we get toward the end, we go into a lot of visual. There's a lot of visual deficits that can actually cause a lot of physical ailments that are not even associated with the area. Due to the lack of coordination in the eyes, it could be a lack of endurance in the eyes or a lack of control between there and the vestibular system as well. So putting all that together paints a whole body problem, not a specific. So if you're coming in with neck pain and knee pain, my thing is what part of the body is contributing to the bigger problem, not so much of where the pain is itself, unless you've had some sort of actual physical trauma to that area.
Yeah, I mean, this is pretty fascinating, and it's new information to me. I don't know about anybody else on here because, typically a hypermobile person gets to the point that they understand they're not a typical physical therapy patient. They're not going to go in there with an injury, and it's not going to be do these things and build strength in 6 weeks. You ring the bell and you're out. We feel like we're on the forever PT plan, which is challenging, both body, mind, and pocketbook. Um, but what you're doing with patients seems really interesting in the sense that, and correct me if I'm wrong, patients are coming in, they're having the assessment, you're doing the testing, and then you lay out their individualized treatment plan. And it almost sort of like breaks down those things that say, these muscles and these things are sending bad signals. So we're kind of going to like break you down and start you up to build you up from the proper way from scratch. And the end result is everybody that I've talked to that's been through your program, like doesn't have to go to PT anymore. So I feel like, there's some magic sauce in there. So tell us a little bit about, you know, the the body work that you're doing.
Yeah, I think it's a combination of both the body work and the programming. When we're looking at the body, what we're trying to do is one is restore mobility. A lot of people think that if you're hypermobile, you're too loose. You can be tight in a lot of different areas. A lot of people are tight, especially the thorax area where everything is kind of guarded. So the limbs, because other areas are so tight, it causes more strain on the joints that are more mobile, which can cause more subluxations and dislocations or just pain. And when you're getting assessed and understand that the muscles that are needed to stabilize are tight and the ones that have more force are loose, we have to find a way from whether it's a fascial standpoint, it could be neurological. There's a technique that we use called Myokinesthetics that is a brain and posture rebalancing technique. So it's a combination of touch on the muscles with a little bit of pressure to get insight or to give signaling to the brain on how to contract those muscles correctly. So we do this a lot in even our assessments. We'll do before and after. Let's say we check glute strength, and as soon as we press, the leg just flops down on the table. We'll do the technique, we'll redo it, and immediately it's holding very, very strong. Well, you didn't get stronger in 3 minutes of a treatment, right? Your brain just reconnected to the muscle. So we were able to differentiate, do you truly have a weakness or is it a muscle, brain to body disconnect? And so by doing techniques like that, we can see, okay, in your case, it was a brain to body disconnection. Now, if I were to press and it was still dropped, now that tells me, okay, I need to create a program that allows this muscle to activate more so we can start building strength. And with the techniques, a lot of it's kind of funny because I call it like the woo woo, because when people who have already gone through it, like it's such light touch in certain areas, but it's enough to get the brain stimulating um, all the muscles that are required to provide that stability, in addition to true fascial restriction. So if something's really locked up and you're not able, especially with breathing with those with secondary conditions like POTS and things like that, there there could be a lot of visceral restrictions in the abdomen that need to be released or uh, be manipulated in a way that allows that person to get better blood flow, better mobility, better rib expansion. So with that part though, the other side is the program, because We make it from scratch. We don't give the same program to everyone else. So it is tailored to you. Now, the treatment that we do, the program actually allows this to hold. So it's a kind of a teamwork thing, because there's times where if you do the treatment, but the other side of it is not done, it's gonna take a little bit longer to get the results that you'd like, because the idea is that we specifically organize the movements on the program based on, one is autonomic functioning, and two, progressions that allow your body to receive the information correctly. So we're not just throwing a bunch of stuff together. We actually have to put them in the right order to get the maximum results. So if that program component is not being done, it does make it harder for these results. But I've seen it when it's actually done in conjunction with the treatments, it works great, because now we've tapped into that nervous system. You're doing the movement specifically tailored to that part of the nervous system, and then things start to stick. And really, I guess the best way to explain it, they are slower progressions of movements on the program, because it's built over the course of 8 to 10 weeks. There's 6 different levels in the first phase. And the idea is to slowly build the blocks in smaller information, so your brain doesn't freak out with it. Because a lot of times new information, the body's like, whoa, hold on a second. Then you have a flare up, or you have a rebound. This program is really built to get small incremental progressions. So by the end of it, you see the larger progression. I think that's the most important thing about working with connective tissue disorders, is that people will jump from 1 to 5 when they should be wanting to go from 1 to 1.5, 2 to 2.5. And the thing I'll say is that anyone that I've ever seen from day one, after they've done the program, and let's say they've had a flare up, they never come back to 1. They'll go back to 5. And I think that speaks volumes on setting the foundation of your body, is that once it's there, you really are more tolerable for things in the future if things were to occur for whatever reason.
Like an injury or a subluxation,
Correct.
because,
Correct.
that's really common. So what you're doing in the long run is actually, helping stabilize those joints and reducing those occurrences. Why do you believe that is? Like, is it the strengthening?
For what?
I mean, for the ability for you to help a hypermobile person.
Oh, okay. So I think too is one once they got that point of motor control, there's active the muscles are much more active, so the contractions are much better. In addition to, obviously, because after phase 1 you go into a progressive, the same way, slow progressive strength training as a way to continue to build on onto that stability. So long term, it's not just, I tell people, if you had EDS, you did just to get it yesterday, right? This is something you've had all your life. So if you're coming in with, you're 20 years old, 20 years with EDS, so that's not going away in 2 months.
Yeah.
So what I tell people is, like, there is a light at the end of the tunnel, but there's got to be some sort of patience and with that progress, because once you get to that point, I say most people, by the time they get done with phase 1 and phase 2 and then start getting into general exercise, that's like a 9-month process. Now, it doesn't have to be with me, but I'm saying in general, that process is fairly long, because they've gotten through the foundational phase. They gotten through the beginner to intermediate phase strength, and then they go into their actual whatever type of activity they choose to do. So it's more of a patience in seeing the smaller wins. That way, once you get to the end, it's much more longer lasting results than it is on other things that I've ever seen with other clinicians, and even things I used to do before I started implementing these programs. So I think right now there's not a ton of research of yet on post strength training and how that is affecting the connective tissue. But this year we've actually even done a small study of Baton scales, and we've changed Baton scales on a lot of people, and so that does say that there's some sort of change within the connective tissue that's actually, although it's still lax, is it as lax as it was before? And that's to be determined. But that's been very interesting to see this year, is that there is a component that although you feel like you have faulty collagen, there's still a component when you're strengthening it is getting tighter and it's getting stronger because if you're able to still stabilize, there's something physiologically that's happening.
Yeah. Wow. Imagine,
Mhm.
people on this call and around the world would be like, I need to do that, right?
Mhm.
So is that what you would describe as one of the things that you incorporate of myokinesthetics? Or can you
Yeah,
explain?
so the
Okay.
myokinesthetics, I think, plays the bigger role in connecting the brain to the body, regulating the nervous system, the autonomic nervous system, and also helping with internal gastrointestinal function. So that's a big, heavy nerve focus, depending on what section of the body you hit, as well as what specific condition are they working with related to those areas.
So if people wanted to learn more about what you're doing, they could Google the term myokinesthetics. Obviously, they could go to your website, which we'll share at the end. It because as you probably know, all of us EDSers, we're on like a constant search to
Mhm.
find answers because the medical community by and large has left us out. And so I always tease and say it's like you got to get a DIY doctorate degree to be able to speak the language, and to be able to understand what's happening. So we often get fascinated, like, give me the term to search so I can learn about it. So myokinesthetics, that's great. So
That's just one of the components to it. Because I'll say this, that's not a technique that we ourselves invented. That is some his name is Dr. Mike. He's an amazing clinician, but that is one of the techniques that we have utilized that has been very, very beneficial for our patients.
yeah, it's very exciting. So you've mentioned a couple of times people with dysautonomia or autonomic, dysfunction or POTS, and everybody on this call knows that those conditions, often overlap with hypermobility. Is there a way that you address, the autonomic system? Like say for example, I'm a patient, I have EDS, and then you learn I have POTS. Like, do you treat me differently, or how does that come into play in your practice?
Well, I think that for most of the time, there's a bigger percentage of people who already have some sort of autonomic dysfunction. So we always consider that when making a program. Based on subjective, if they're having fatigue, if they're getting headaches, if they're getting things that kind of go in that direction. um, the biggest thing that I've seen for POTS, obviously the hands-on is great because we're able to tap into certain systems of the body that allows the body to re-regulate itself. um, there's parts of the body that are more sympathetic, there's parts of the body that are more parasympathetic, so there's a way to use these techniques to either target one or the other or both at the same time as a way to get the system to start receiving information and not be so hyperactive. The second part would be with POTS, because there's that cardiac and pulmonary component. If if that if basically if there's too much strain on that area that and those areas for them are a bit more hypersensitive, it can cause, right? It can cause fatigue, it can cause passing out, things like that. So there's got to be, again, smaller dosage of information via exercises or the movements that we give. So I don't really call them all exercises because not all of them are exercises. Some of them may be breathing related, eye related, but they're just movements given to the body. We're trying to avoid compensation. And compensation in general will cause strain, pain, autonomic dysfunction. So if we're working with someone with POTS or dysautonomia, we have to find a way to, one, get blood circulating better for them so they don't feel as faint and fatigue. And two, how can we build up their system to start learning resistance and learning um, movements that require a bit more effort without sending a signal through the roof in the brain of, okay, it's time to stop. That's it. Basically, there's a term that's used in vestibular rehab called habituation, where let's say if you have motion sickness and you're doing eye tracking and it takes you only 3 times for you to feel dizzy, and then maybe over 3 weeks you're doing the same exercise and maybe it takes you 6 times to feel dizzy. That's habituation. Your brain got used to it. You didn't change the stimulus, but because your body slowly got used to it, now it's more tolerant of it. The same thing, we have the same idea when it comes to movement and exercise, especially with POTS, is we try to gradually give them a small dose, let them get used to it, give them another small dose, let them get used to it. That way, that dose at the end is the full dose. We just broke it up into so many different compartments or levels that the patient is now able to tolerate it versus going from 0 to 10.
So all of this in your approach is much better on our bodies because, we typically, I bet everybody here can tell a story about going to some sort of traditional physical therapist, and you get like pushed into something that's too hard, or, you strained something, or it felt fine when you were there, but then when you get home, you can hardly walk. You know, I got hung in, those red ropes one time. It's like, I mean, we're willing to do almost anything, but yours is a very careful, methodical approach to rebuilding the system so it will sustain. That's pretty exciting. Are
And
you
also,
gonna
I'll
go
add
ahead?
to that is that the thing with POTS is right standing up against gravity, and so the bigger component is that we start laying down to sitting and standing. So we're trying to gradually get the brain ready for being against gravity and the changes in how it has on blood pressure. That's another component. So it's not just, oh, we're giving the small ones. We're actually using positions to gradually get your body ready for it.
It's pretty cool. I mean, like my brain is trying to wrap around, all of this. So where, I know you mentioned a moment ago that kind of pain was secondary. And patients may or may not recognize, this sort of neuromuscular work that you're doing. They just want to like get rid of pain. And, you might say you're compensating and, they may or may not know what you're talking about. So how do you work with your patients on kind of the pain management part?
I, th- uh, I would say what we first work on with pain management is obviously the hands-on. That's the one that probably gets the bigger relief because there's usually some sort of fascial restriction associated with pain, not just purely compensation. Those areas, once those areas are moving better, those areas are less restricted. It could be uh, maybe asymmetries in the body that need to be adjusted. From a manual standpoint, those are the things that people will start to feel less pain and more relief. But because we have so much experience, I know timeline wise when that's probably going to go away. And one of two things, it's either later in the program, like midway in the program, once your brain has been able to adapt to the new information, apply some of the new movements, so you're not compensating as much, therefore you less strain, less pain. But two, this also helps with more complex conditions. There's times where it doesn't normally
So
follow the
today's speaker,
pattern,
we have
or maybe
Caroline Kamer, and she is with
Oop,
Revival
you're breaking up a
Wellness,
little
and she's
bit.
going to talk to us about
they'll fly like, okay,
some exercise and Pilates
Jonathan,
type
can you hear me?
exercise to help us when we're at home and during these summer months
Yeah, can you hear
to
me?
try to just not get into a
I can hear you.
deconditioning mode,
There we go.
right?
You broke up
And
there a
to
little bit,
continue
so the
our
the latter
progress in
Oh,
part of
so
what
sorry.
you
wellness.
were saying, if you
And
would repeat
Caroline
it.
is also
Do you know where I left off?
affiliated with Stephanie Hahn, who some
I
of
mean, it
you
wasn't
may
too
know.
much, maybe the
Oh,
past
She's
okay.
second.
also going to be
I
speaking
would
to
just
us in
say we
fall.
address pain through a
So yeah, I
manual
will let
techniques
Caroline
related to
talk about her
myokinesthetics,
journey and how
myofascial release,
she
visceral
got to
manipulation.
be
Basically,
joining us
anywhere in the
today.
body
And
that
I'll
has
let
some
her
sort
take
of
it over from
restriction
here.
and tension tends
Thank
to
you so
help
much,
early
Christy.
on
I
with
really
pain symptoms.
appreciate
Now,
that. And it
what I
truly is an
what we'll
honor
usually find is
to
that
get to
pain
speak
won't
with you
just
all
go away.
today.
Pain
Not
will
only
reduce in
share my
intensity and
story of
reduce in
how
frequency. That's
I
what we're
got
looking for
here,
both
how I
because
got into
a lot of the other
Pilates,
components are
and
related to
really working
instability
with
and mobility
people. So,
issues.
um,
Because we know
I was a
timeline wise
very
how long
active
that takes, we
person,
will always educate
and
the patient on,
this
okay,
is where my
in your
story
case, it's
begins.
probably going to
I rode
be at this
horses
level or at this
competitively
week
all
before
through
you start
school,
seeing
even
an
up through
improvement in this area.
college, and traveled,
Because
and
we
was
believe
just
that the
such a
body gets better
physically
from the
active
ground up.
person.
It's
Something
based
I
on a bunch of
truly
different
loved
techniques that we've
was
tried.
moving
And
my
we'll tell people
body.
the lower body is going to
And
feel
it's
better
something I did
quicker
quite
than the upper body.
often. I worked in
There's,
the corporate
we have
world as I
proprioceptors in our
graduated.
feet. We have our ankles. We
Working
have
in
bigger
major
muscle
sporting
groups in the
events. So
lower half that
movement
tend
was
to get
really a
better
large
quicker.
part of
What it does is it
my
exposes
life.
the areas in the upper body,
And
neck, shoulder.
it
So
all
when I'm
changed,
explaining to
and it
someone,
felt
I will
like
tell them
my life was
everything from the waist
ending
down is probably going to get better
when
quicker
I
than
had a
things
really
related to the
bad
upper
fall
body.
from a
In addition
horse.
to, because
And
headaches
I was
rely,
31 years old at that
there's so many
time.
things that go into
And
headaches other
I
than
was being
structural issues.
told
There's neurological
I would
issues, there's
walk with
circulatory
canes for
issues.
the rest of my life.
That is the thing that I tell them
And
that may vary,
that
because
physical
that
activity was
requires so
out of
much
the
more stability for
question,
the
and to
entire
just
body for
kind
that
of
to
let it
relieve
go
versus an ankle pain
and
doesn't
find
necessarily
something
need the
else.
entire body for it to be relieved.
That was a
So
moment for me.
in that
I really,
aspect,
it was such
pain
a
relief
turning point of what
is
do I
via
do
the
now?
manual therapy in
I
addition
know
to
you all have
the
also
programming that we
received
have.
a diagnosis like
Yeah.
that, where you're
But
just like, what do I
I'm
do?
pretty impressed. So is
How do I
this,
live now? And really
practice
being
of the
thrown
way that
into
you're
this
doing PT?
crazy
Is it catching
cycle
on
of
around the
what's next
country?
and what does
Tell
life
us a
look
little
like
bit,
next.
will people start to see this? Are
I
you presenting at
I went
conferences?
through all the
Yes,
emotions that
so
you
it
could
has
go
been,
through.
we do see a lot of people
So I
virtually
had an injury to
from different
my
states and even different
L4,
countries as
L5,
far as
S1. And
England, Portugal,
I
South
went through
Africa,
the medical
Italy.
system.
We
I
have
felt like I
people
was
from
a ping pong ball,
quite a
just
bit of
being
places.
just hit
And
all the way
even
around,
without the
going from
hands-on
one
techniques,
provider to
the
the
programming
other,
has
and
still
no one
worked
could
very,
really
very
give me
well.
answers of
So right
why my
now,
body was deteriorating
because of
like it
a
was,
lot of the trial and error
why I
that
couldn't
we've had
walk,
over the last few
and
years of
why I was so physically
certain
sick
exercises, certain
with
progressions, I
this
think right now
injury.
we're at
And
the point that we have most of them pretty
I think I
solid with
speak to all of you
what
and
we
how
feel like the
frustrating that
body
is when we feel like we
works
can't get
through
the
when it
answers that
comes
we're
to that
looking
recovery.
for.
Um, as
So
far as speaking at
finally,
conferences, I don't have anything
we
listed, but we
came
are
close to
going to
what
be
we thought
launching
was the right
our informative
approach.
podcast soon.
So
I have some
I chose
collaborative work with
prolotherapy alongside with my
some physicians
orthopedic.
in the
We
Houston
thought
area
it was
for
the right thing to
cardiologists
do for
and
what my body had going on.
a lot of
And
different
the
people
first
right now
treatment
is
went
what we're
great,
working with. But
and I loved that it was more of
there's
a
a lot of things with
regenerative
programming as
approach.
well. We'll be launching
But
our
my second
online
treatment went
movement-based program that
wrong in
we actually
every
give to our
possible way it could
patients
have. And
online.
they
The goal
hit
is to have it
several
launched
bundles
by
of
April.
nerves.
We
They
have a
went
new
way
motion
too
sickness
deep.
program
And
that we just finalized after
that's
working with
what
a trial of
really
people
started my
that we'll be
journey
launching
of
here pretty soon. So
having
most of
my
our
right leg
services for the people that can't come
paralyzed
in, we
and being
have
in
a lot of
constant
these
nerve
effective
pain
programs that we've been
24
giving
hours a
patients that are
day.
going to be available online as resources.
It literally
That's
left
great.
me just
So,
unable to
obviously
care for
your
myself
practice really
and
gets our audience,
unable
and
to
you
move.
understand that we've been,
There's no way I could be alone.
maybe dismissed or,
I couldn't get
hurt
myself
and
up, let
things like
alone,
that. So,
take myself to the
your
bathroom. And
approach
that is a
to
humbling feeling
patients from
when
a physical
you've
therapy
always felt like,
standpoint is really
you had
different.
control over your body
I don't
and
know
you
if you want
just
to share
don't.
anything
And
about
the
that.
pain
I mean, like you
associated with
walk in
it
the
was
door
just
and
honestly unbearable. It was the worst
you
I've ever had
immediately
in
have
my
a
life.
different experience
And
than you've ever had.
I
I
think
I
I think
didn't see
the
hope,
thing that kind
to
of
be
stands
honest.
out with
And every
that we try to do is
professional around me was
we
telling me I
I
shouldn't
feel like
have
we
hope
treat people as
to
actual
get
people
better,
and not a
that
number.
life was going to be
And anyone
on
who's been in the
walking
clinic
canes.
knows we have a lot
And
of
it was
personal relationships,
going to
not
be
so
a
much
long road
outside of the
to
facility, but we do make it personal.
get
Like
this nerve
we are
pain to
invested
cease
in
and to walk
the care.
again.
We know much
And
about the families. Like it's not just like
it
you're in and
was
you're out. And so
really
there's a bit
only
of
when
a personal touch
I
that I feel like that we do with
sat
anyone
with
that comes in,
myself
regardless of condition,
and took a
personality,
moment to
likes,
just
interests,
center,
any of that. It's like the idea
that I was
is
like,
when you're coming in,
this
we really
is
do give
not going to be the
100%
rest of my
effort.
life. I have
We're
no
not
idea
cutting corners. We're really trying our
how I'm
best
going to
to,
go from here and what steps to
to get
take
people
or
better
who
as quick
else
as
I
they
need to
can. So I
see.
think
Because honestly, at that
people
point, I
feel
was
that when they come in.
terrified
It's
to
not like
see
we're
anyone, or
feeding them
and
anything.
people
And
couldn't
also,
really
I
touch
feel
my
like our
body.
honesty,
I
there's
was in
times
such
where
pain.
there might be
But
things that may be so far out of
I
our wheelhouse
finally had
that
that
we're
light
not
bulb
afraid to be
moment in
like,
my
hey, I think
mind
this
of,
is out of our
I
wheelhouse,
don't
but
know
let's see where we
how,
can get you
but
to go.
I'm going to change this.
And I think that
And
building of trust,
we
I think, has helped
often
people,
think
even
that
the
it's
people
when
who
we
may
have
not
that
have gotten
belief
completely
that all of
better
a
come
sudden
back because
things
they know
change
that we
and things
still have
come
the
into
best interests in
alignment,
mind.
and with the blink of an
I know
eye,
from
my
personal
life changed.
experience,
And that wasn't the
when you
case.
come
That
in,
was just
I'm
when
working with you
I
and
turned
it's
the car
just you and
around
I
and
for the
started to
entire
think in a
time that we're
different
there.
way.
you're
but the
not focused
path
on
was
12 other
a
people or
long
3
one.
other people,
And I
and you're
got
not
so
sending me
much
over to a
conflicting
machine to do
information,
something.
which
It
I'm
is
sure
completely
that you can
one-on-one, which
understand
is
that
dramatically different than most of the other
personally. But
PT that
I
other
finally
people are
started to
providing.
sift through
So,
it.
you know, that's
And
wonderful for that personal attention
the more
and that
my
caring
belief
touch.
and thought and
So
confidence
if
that
you met
I can
someone,
start to
you
feel
know,
better,
in
I
public,
can start
whatever,
to
someone
minimize
came
some
to
of this
you
pain,
and they were
even if it's
newly
just 1
diagnosed
degree, it's
with,
1
you
degree
know, a
different,
hypermobile
that
connective
I
tissue
that
disorder,
I'm getting better
you know,
and that
what
I can
of
get
whatever
stronger.
scale,
And
you know, and they're really unsure, like
through the
where to
beautiful
start,
people
like
that
what do
came
I need
into
to
my
do with
life
physical therapy?
and
What would you
that
suggest
helped
to
me
them?
get better through manual
I think
therapy,
the first thing would
physical
be
therapy,
finding a physician that is
lymphatic
very
massage and
knowledgeable
acupuncture
about them.
and
That
pretty
way
much
they can start
everything that
getting
you
the
can think of.
resources
I
and
tried
the
it. It was a
direction that they
really
need.
good
I think
mix
that's a
of
really good point.
Eastern and Western
I think
medicine.
just going
And
to a standard PCP
I
or
was getting
may not
better.
be the
It
best option. You might be running
slowly,
through
slowly,
hoops. So if you
slowly,
can do your
but I could
research and
not get
find
off of
someone
my
in your
last
area, or
walking
maybe
cane.
outside of your area, I tell
Um,
people
and
if
it
obviously if
really
you have the
was
means of
hitting me hard,
transportation
you
or a
know,
way
it
to get
kind
there,
of like that
finding
balloon
someone, even if they're
deflated
out
of
of
my
state, will
confidence.
save you
And
a headache in the future.
I didn't know
A lot
how,
of people
but
have waited so
I
many years and
knew
so many
I
months going to so many
absolutely
different
had
people
to
because they weren't
regain the
able to get to
movement
that
that I
person.
once
But
had,
finding
even
a
if
way
it
to a
wasn't to
person
the
who
same
really
degree that I
understands
used to do things.
the condition
I
is a better way
had
to
the
start,
will
because
to
then they start
continue
giving you
to
the
move
resources
forward.
and it makes that journey
And
that much shorter.
it's not easy. And I know
Yeah,
each and
that's
every one of
terrific.
you
And
know
I
that
love that
it
you're
is
going to be
not an
offering
easy
virtual because
path
you'll be
when
able to
you
help a lot more
struggle with
people.
chronic pain. And
Are there
something that you're
any,
just
you know,
don't
particular
don't
success
know if you're ever
stories
gonna
or, you know,
find a
impactful
time where you're gonna
moments
feel more
that
well
you've
and
had
feel
when you worked
better
with a
and
hypermobile patient that you want to
kind
share?
of
Yeah,
see
I got a
the
lot.
possibility. But it was
I
in the
got
moment when I
it's
held on to
been
the
cool. Like
beliefs, even in my worst setbacks,
we've
that
been
I
blessed to be
finally
able to
felt the
help a lot of
possibility.
different people.
And
But I'd
that's
say if
when
I'm gonna go off the
I
top of my head,
realized
I
that
have
each setback, which
a specific
are
person who had a
amazingly
very severe case of
physically,
PCI.
emotionally, and mentally,
And
just
for
take
those that
such a
aren't
toll
familiar, it's
on
cranial
us,
cervical instability,
that
basically
I actually wasn't
instability in the
going
upper part of the
back
neck,
to
and
zero.
that can cause
I
very,
was
very,
just a
very
little
severe
setback.
issues
I
and
created this new
difficulty with
foundation. So each time
just
we had a
life, period,
setback,
not even
changing the way that
anything
we're
else
able to
outside of
think
that. But
about it as, okay,
this
this
person
isn't back to square one. This is just
enjoyed
a little
dancing, and
setback. I've created this. This is
you know,
just the next
at
mountain
that
to
point they were
climb
in the end of
and the
their road
next thing
of
that I
trying to
need to
figure things
focus
out.
on.
And you know, over
And
the course of time, that
that helped me
person
see
went
more
through
clearly.
basically our
And I'm
programs and
so
the treatments,
thankful
and they
that
ended up going back into dancing, going
through
back
that
into
strong
work,
belief
and those kind of things
and
that
through my manual therapist,
you know, maybe
he was like,
someone
okay,
have
your
said
time, it's time
otherwise
for you to
that person
start
could
some
do.
movement. And I was still
We've
on my
had
cane,
I've had
and
people that have gone
I looked at
into
him shocked, and I was
competing
like, I don't know
on American Ninja Warrior. I
how
actually had
though.
someone specifically
So that was my
that I
first
know that
introduction to
went
Pilates,
from
is I
actually
started
cut
working with
her
someone
vestibular nerve
one-on-one. And
due
I'll
to
never
a
forget the
brain
day
tumor,
of
and they ended
being
up
sat down on a reformer
retraining, vestibular, all
and
these kind of things, going back
not even
into
being able to
competing
fully
on
straighten
that
my
show, which is a
legs with
very
no
harsh
weight.
thing to go.
And
I've had
our
someone,
muscles atrophy so
yeah, I
quickly.
mean, the
I
list
was
goes
like,
on.
I
I've had
can't
someone
do
that
this. I don't know what
used
he
to
was
pop out of
talking about.
socket just by
But
turning a
it
doorknob.
was in this moment
And
of
I recently went to their
being with
wedding,
right people
and
at the right
now
time,
this
and
person is doing
Pilates
regular fitness at the
absolutely
gym.
changed my life.
And it's just like when you
It is
see
the
those
one and
things, you're
only
like,
reason why
wow,
I am
like
now
all
not
the
walking
hard
with the
work, you know,
cane.
I feel like we're the resource, but
Yes,
the
do I still
patients are
have
the
to
one
have
who do all
physical
the
and
work, you
manual
know?
therapy once a
Um,
month?
and yeah,
Absolutely.
it speaks
That'll
volumes
be the
for
rest of
what's
my
actually
life.
possible. Literally,
I just
there's so many
can't sustain
stories
this
of people
without
that
help and body
have
work.
done
But
big things.
Pilates
For
has
those that are actually
given me
listening, and this
stability
isn't like a
that
like
I
a
didn't know I would
PSA or
ever
anything, but like
have again.
there really is a lot more that
I
you
was
can
so
do
unbalanced, and walking
being
with the cane for
hypermobile than
so
you think.
long,
I
my
know a
body
lot
was
of people
so
that
pulled
maybe not
forward, and
are as
I
educated in
lost
this may tell you something
all core
different.
muscles that
But for
I
someone
had to
who's worked in
regain
it for
that.
15
And
years, there's a
that's the
lot
beauty
that
that
you
I
can do. It
found
takes time, but
with
there's a lot that you can
Pilates,
do.
is that it can
That's awesome.
so
And so much
gently
hope.
help
So
you
if you're ready, I'm going
refine
to go ahead and see if
the
there's any
muscles in your
questions.
body,
I'll start out with
overall
one
body
that's in the chat,
awareness,
and then
and
for those of you listening, if you have a
it
question,
changed my
you
life.
can put it in the
So
chat, or you
through
can
all
raise
the things that I had going
your
on,
Zoom
I really
hand,
got
or
clear
turn your
that
camera on and show us
working in
your actual
marketing
hand,
and the corporate
whatever
world
method
wasn't for
works for
me, that
you.
I
But
really
the
wanted to
question in
help
the chat
people.
right
I wanted to
now
help
is
people
from Karen,
through their moments
and
of
she's asking,
transition,
do you have
to
any
help them
experience with
find
treating people with
their
EDS
confidence
and
again,
vascular
help them
compression
find
syndromes?
the
Like, for
courage
example, May-Thurner
to take
syndrome
that step
or
forward and maybe try
median,
something new, because it
I
is
don't,
terrifying when you're used to
malls, I
having
guess is what it
setbacks.
is.
It's
And,
hard to be
you know,
open and
these things
remain
are
open
very
to
restrictive
trying new
and cause a
things,
lot of pain.
and
Are
to
you
help
working with that audience?
others find clarity
I
in
have,
whatever they're
yes.
going through.
I've actually worked
So
with a lot of
I
mouse
decided to become a
patients.
certified
May-Thurner, I think I've
life
had
coach
just a
and
few,
health
but
coach.
I think
And that's really where my
malls,
journey
if it's going to
began.
be one of
And
them,
then
that's
as
the one
I
I'll
was
see the
working with
most.
people, how
I
interconnected
would
our
say,
minds, our
even being
bodies, and our
transparent,
souls
it's
are
been
all
like a
together.
50-50 success because
And
some of these can be so
Pilates
severe, the
has such
compression,
a
that it does
special place
require
in my
some sort of
heart
surgical
that I decided to become a
intervention.
certified
But
Pilates
I've also seen it
instructor
to
so
where
that I
things
could
have gotten much better and they didn't
help
actually need it. So
share
that's
what
just
I
based
learned through my
on the
challenges, through
group that I've
my
seen.
Yeah, and probably when you're
most
seeing them, right?
my biggest moments
Correct.
of weakness, that
So another
that
question
there
in the chat
you
is,
can
do
find
you
a
treat
gentle way
patients with
to
pelvic
slowly
floor
start to move your
dysfunction,
body. And
as
that's really
well
what
as,
I
EDS and
want to share with you
endometriosis
all
and,
today. And one
all
piece
of
of
that going on in the same
my
patient?
business, Revival
We
Wellness,
do.
is
We actually have a
that I
pelvic floor
offer
therapist on site.
mobile Pilates, so
And
that I
all
come
of
to
our staff
you.
members
That
are
is
certified in
something that
external
was so
pelvic
important
floor.
to
We have
me,
one
as
specifically
I
who does
was at
internal.
my
So
lowest moments
that's
and
actually part of our
couldn't
testing
drive
process
and
too.
couldn't get to
I forgot to
places
mention
where
that, but we do
I
check
needed help, but I couldn't
the
get
external
there.
pelvic floor during our
That I
evaluation to
always
make sure.
knew when I became a certified Pilates
Awesome.
instructor that I
So
would
the next
offer
question in the chat
those
is,
mobile
what's your
services, because
approach for
not
CCI
everyone can
patients
get in a car and
not
drive.
to trigger
They
an
have
MCAS flare?
too many physical difficulties, and it's just not a
I feel like everyone
possibility.
with
So
CCI is a
that
bit
is
different
one thing that
because
is near
the
and dear to
severity.
my heart,
So
is
I would,
being
if
able to
I'm gonna
provide that
take like an
and to
average, like
come to
medium,
you, so that we
medium
can
involved
work
CCI
one-on-one.
patient, there's
And
typically with
I also
CCI,
have the
there's
amazing
people
opportunity,
who
as Christy shared,
choose
to
to
work
work
with
on the
Dr.
neck,
Stephanie
whether
Hahn
it's
in
chiropractic for
Westlake, and
PT.
we
There's
have a
the
full
activator that
studio,
they
and it is
use sometimes, or maybe
one-on-one
other interventions. Doesn't matter, training
tailored
cycle, whatever.
approach, and we really identify what
I
your
have
body
found
needs and
that
have all the
initially those for
equipment here
CCI, by actually working on the
to
thoracic
help
area
support you.
without touching the neck,
And it's just been
and
such
then
a
working on the
privilege to
skull, so just
help
here,
people
not so
walk
much
through
of like
their own
pulling on the
path
neck.
and begin to
I
see
have
the
found that has
possibility
helped
of
reduce those
what
kind of
their
MCAS
body
flares, or
is
just general
capable
flares
of.
of pain and
And
discomfort,
of
because
course,
you're not actually
slow and
targeting the area in the
steady,
middle. You're targeting
and
above
giving
and
your
below
body
as a
time
way to
to
reduce the
adapt to
strain
new movements
on
is
that area.
so
And I have
important.
found that to be the most
And
successful, especially
finding
early
that
on for folks
patience in
with
that to
CCI.
go slow.
Yeah, I know
You have to have
when
that
I was diagnosed
persistence
with
and that
CCI,
resilience that
it
I
got
know
so
all of you
bad, the
have.
neurological
And
symptoms and the balance,
I
and,
just feel so honored to
like
get to share it
bobblehead and
with
walking into
my
walls, and,
clients, and to help
it
them
was
see that there
really
is a gentle way that we can help
disturbing
start to
and
get their body
frightening. And,
moving and start
at the
to
time,
engage their
you don't know
core,
where to
which
go except to a
helps with
neurosurgeon.
all sorts of
So the
stability,
thought that there's an
moving,
idea of
walking,
somebody
even
out
just
there,
holding yourself up in a
like
new way
you,
with
who might be able to
posture.
give you some,
If we can
therapy
engage your
to
abdominals,
rebuild,
we can help support
that's
your
almost
back,
crazy.
which
It's
is
pretty exciting.
my biggest problems, my back, my
So,
hip, all the
yeah,
nerves
I
throughout
don't have
all
any
of
more
that.
questions in the chat.
It
Anybody
changed my
want to
life,
raise their
being able to
hand,
strengthen
or
my core, and I owe that to Pilates. So
I'm pretty
anybody have
open.
any?
I do want to
Shoot from the hip.
definitely
I
highlight
see,
that
I believe
I'm a
Karen is
certified
turned off her
Pilates
mic.
instructor.
So
I'm
Karen,
not
go
a
ahead.
Hi,
medical
sorry,
professional. I'm not a doctor. So
I should have
I just want
asked
to
questions
throw that out there, that
verbally before.
that's not my specialty.
I
My
just wanted
specialty
to
is
ask
understanding
if
the
somebody
body through
has
Pilates and the movements and exercises that we can
thoracic
do
outlet
together.
syndrome as
So
well,
the three
along with
exercises that
their
I'd love to take you
EDS,
through are
where you've got
the
potentially an
foundational exercises that
injury, but
I
also
personally used to
maybe a
start to wake up my
neurological thing. Is
core
that
and to
something that
begin
you've worked
to
with as well?
start to develop that
Whether it's
transverse
with
abdominis, sinus, which is our
does
lowest
that,
and
do you
most
treat those
deepest
kind of
layer
things like a
of our
normal
abdominals. That's what
injury? and
That's the
build the program
stabilizing
around
muscles that we have
and
there.
the rest of the
And I
hypermobility.
again feel so honored that I have
Correct.
this
Yes.
opportunity to show
And just
you.
to kind
And
of paint a better
if any of this
picture,
can possibly help
most
you at
people
some
don't just come
point,
in with hypermobility.
I just
They're usually coming in
I
with
just
about
really
3 or
hope it
4
can,
different
and
things that
I'm
usually
so
come with
thankful
it
for this. So
from the nature of the condition.
I
So
am going to
it
take
could
a
be
quick moment.
PRE, it could be
I'm going to
CCI,
take you
it could
all
be
over
serums, it could
to
be
Matt so
supported
that you
temporal
can
cord, and so
see me actually
thoracic
do the
outlet.
exercises, so
So
you can
when we
see
are considering
what
that,
we're
that's what makes the
focusing on
programs a bit tricky,
and
why we have to
how
make
we're
them
using our
individualized, because
breath
no one's coming
to
in with the same
engage
grouping
our
of
abdominals.
secondary
So
diagnosis
just give me one
in
brief
addition to
moment and
EDS.
I will be
So
right
yes, the answer
back.
is yes.
Yeah, we're all our own unique puzzle. Yeah, absolutely. Are there any more questions in the audience anybody wants to ask? Feel free to turn your mic off or raise your hand. Katie.
Hey, I was
Okay.
chuckling because it's like, oh, somebody who has an injury all the time. Oh, that would be me. So I actually have to call you and make another appointment soon. But anyway, I was wondering what you saw with the Wavi that you were doing. I don't know if you talked about, I don't
Oh yeah.
think you briefly mentioned it, but I was just curious what kind of changes you were seeing with that and what came of that.
Yeah, so it's actually I'm in the process of talking with Austin right now on the write-up. But we saw, at least from the PT side, because I know they analyze the very specific ones, but we saw,
Let me pause you for a second. Will you back up and explain what you're talking about to other
okay,
people?
so the Wavi is
Okay,
a
Christy, can you see me? I
brain
just want
scanning
to
device that we
double
used
check that
last year
everything
for the
is
research that we're doing on
all
Everything looks
situated.
perfect.
essentially
Okay,
PTs
perfect.
targeting the
So
brain
I'm going
first
to
before the
talk
body
through
as
the
a way
exercise
to
first, so you know what
find
I'm
a
trying
different
to
treatment
display as I
intervention to
show
start
you through the video.
the recovery process for
And
those with
then
EDS, POTS, and
I can go
dysautonomia.
through and really highlight what
So
I'm doing
with
when
that,
I'm lying down on the mat.
we
So
did a
the
test on the
first
day of the
exercise, and
assessment, and we did
really
it
the
up to 10
most
weeks after the assessment. We
foundational
compared the
exercise
changes.
that we're
So
going to do is something
what we
that
saw
I
is just,
call
I
zip
guess,
up,
the layman's terms
exhale,
version. Imagine
belly.
you're seeing a piece of like
It
a circle,
uses our breath work,
and
just like all of these
red,
exercises,
orange is
in
a
a
very good
really
color.
deep
That means it's
way
very, very active. If it's
to
blue or
engage our
green, it's kind of
abdominals.
not as active.
That transverse
And so
abdominis
essentially the EG, it should be fairly
is really the
symmetrical,
most
and we should
important
have
one to
good
wake
brain
up for us to
voltage, so that
stabilize
red
deep in our
orange
core
color
and
on
be able
both
to
sides
hold
of
our bodies
that
up
circle,
using those muscles,
central
which is what
parietal
they're
region of the brain.
intended to do.
And
So for
when we did our
this
testing,
exercise, we'll be lying on our back,
pre-testing, we
knees
found that there was
bent with our
maybe
feet
more
flat
blue
on the
in the area.
floor.
Maybe it was like
So a
heavy one
really
side
nice
that had more brain voltage than the other side. And
position where we're
so
feeling
we saw a
very
lot of
supported.
asymmetries and a lot
I
of
recommend if
decreased
you
brain
have
voltage that
a mat,
essentially correlates
especially
with
if you have a
reduced
thicker
autonomic
one,
functioning.
just to give you
And when
nice
we're thinking
support
about that from the
and not on a
PT,
hard
because we have
surface,
no other
that
way
is
to really
always
measure other than
best.
subjective
So I'll go ahead and lie back and explain what I'm
on
doing
autonomic
here.
functioning, right? If they're saying, okay, I was constipated, but now I go every day, that's the subjective part that they're giving us for us to track it. But now we're looking at
So
the
this
Wavi scans as a way to
exercise,
say, okay, now we're looking at different types
Yes.
of waves in the brain that are
You
changing.
might scoot up just a little bit towards the
different,
window.
types of
about
voltage, the
a few
reaction
inches.
time, all these things that we're seeing on paper that show, okay,
We're missing your knees.
PT can
If you
actually
scoot just
start
there you go.
going to the brain as a way to
Perfect.
affect the rest of
Beautiful.
the body
Thank
versus
you.
just trying to constantly do strength training.
Good.
And that's
Yes,
what
definitely
Katie
want
was
you to
talking
see all
about
of this.
was
So my
we
knees are bent
saw
and
a
my feet are
huge
flat on the
component,
floor here.
a high percentage of people that
Arms are
change
down
within the
by my
first 8
side
to
if
10
that's
weeks, and we're like,
possible with
wow,
your
we changed
body.
that much in
And just
that little
relaxing
time.
the
So
shoulders back
it
and
was very
down,
impressive, and
allowing
I'm
them just
hoping to have the
let
write-up by next year.
gravity slowly let them
Actually just had a meeting this morning
relax
about it, but
down.
yeah, that's
The
what
one thing I
we're
want to
finding. So
point out that's
we're
very
working with some
important
people
throughout
to
all
get
these
that written up
exercises
from a
are
PT standpoint,
we are
because I don't
not
think there's much
forcing
PT used in the Wavi
anything.
yet.
We are just
That's awesome. Very cool.
gently
Yeah,
using
very
our
cool.
body and our breath
So
to start
someone in
to
the chat
activate
is
and
asking
use
about,
our
you
abdominal
know, you being
muscles.
able to
So
work
we want to
with
make
the
sure that
population of
we're
people
not
that,
ever
you know, have
forcefully making things
Lyme
move in our
and
body.
or mold, you
We
know,
just
issues.
want to be nice and tender
Is
and
that a
gentle with our
population that you
bodies.
believe you
So
can
with
help?
this one,
Yeah, I think it
I like to
also
think
works
about
well,
taking that
whether it's
deep
like a
breath
naturopath or some sort
in.
of physician,
So
because
I'm going to put
obviously
my
if some
hand
sort of
right here on my belly so that you
toxicity to
can
the
watch
body
it
needs
rise.
things that are a
So
bit
we're going to
outside
take
of
a
what PT can do.
big belly
But
breath
because those
in,
things affect the
expanding through the
nervous
belly
system
here.
in a very
So
similar way
take an
that
inhale.
other factors like POTS and dysautonomia, there's that
So you can
component
see
that we
how much
actually
my
are
belly
able to
has
help with.
risen
So
here.
I'd say for Lyme,
And
it's
we're going to inhale
it's
for
a
a
bit
count
easier.
of 5. So it's a nice
From
little
the
breath.
PT side, mold, it's kind of a
Really
twofold because they need that
filling
side of
that belly
the
area and expanding
the
it
internal
out.
things that they're
Now,
intaking
as
to
we
help
deeply
counter the mold,
exhale,
in addition to what the PT
that's
can
why we
do
call it zip
from
up belly. Almost
re-regulating
think
the
like you're
nervous system.
zipping up the abdominals, right?
So-
So we're
Re-regulating
going
the
to
nervous
exhale
system.
like
That's
a
I
wave,
like that.
flowing down,
That helps
melting
me
our
that's
spine and our
understand
back
what
into
work
the
it is that
mat.
you're
So
doing.
we're going to take that
Because
exhale.
most of us out there, we understand the language of, okay, I have a dysregulated nervous system,
And you
or,
can see how much my
so
belly has dropped
re-regulating the nervous
because
system. I
now
like
my
that.
back is
Anybody else have
connected
any
to the
questions or
mat.
comments?
It is, my spine is literally gently
All right,
melted
I'll get
into
ready
the
to.
mat
Oh,
underneath of me.
Amy, do you have your
So as
hand
we
up?
inhale, remember,
Nope, she
count
changed
to
her mind.
5. Inhale.
All right. Well, the good news is this recording
Exhale.
is going to be put out there on YouTube.
You can see that
And
rise
Jonathan,
and
you can
fall
decide
of my
whether we
hand,
share it,
and you
kind
can
of with
see
everyone
how
and
I
they can find
melt
it, or
down
whether
like a
it's private
wave.
for people that
So
just have
as
the
you
link.
do these,
But
again,
it'll be
gently
published
using
in
our
the
breath
newsletter
and
that I
inhale for
contribute
5,
to that's
4,
called EDS
3,
Share. And if
2,
you aren't already
1.
subscribed, you can at
Exhale 5,
edsshare.com.
4,
That's a
3,
collaborative effort of a
2,
lot of patients
1.
working together
And
to
as we breathe
share
like this
information,
very
because
deeply,
there's
not only
just
are
a
we waking
vacuum
up
of
these important
lack of
core muscles
awareness
to
and
give us that
information.
stability
So
that's
as we all
essential,
are individually
we
kind
are
of geeking out
also
and finding these
having
things
a
out,
nice
it's
stretch
so
through the
wonderful to be
spine,
able to
very,
share and
very
build this
gentle,
repository.
because
So
you're
we launched a
using our breath
repository
only,
recently that's a
no force
searchable,
here, but it is a
it's kind of
nice
like a companion
decompression of the
app.
spine with each
It's
exhale.
web-based,
Let's do that one
and
more
it's at
time. Inhale
you can
5,
access it at
4, 3, 2, 1. Seeing
app.eds411.com.
my belly
And
expand.
basically you go in
Exhale
there,
like a
it's
wave
very
flowing down,
rudimentary,
zipping up
but
those
you put
abdominals.
in,
Exhale
mold
5,
or whatever your
4,
keyword is,
3,
and it's going to
2,
pull up all the
1.
articles from the
And what
3
you'll
or 4,000
find after
entries
doing
that people have contributed to this
3 to
library.
5 of these is you're
And
like,
you put in
wow, okay,
CCI or
I
whatever it is.
feel my core
And there's things
turning
like
on,
medical
even though
research. There might
I'm
be like
just
products
using
or
deep breath
blog
work. I'm
articles from
slowing
someone who
it
wrote about
down
it from
and
personal experience.
allowing those abdominal
Kind of the
muscles to
gamut.
do their
And you can
job
also
to
search by
support me.
category.
And
Like say
all of
you
this
only
should
want to see
feel
the research,
really, really
and you can make
good.
a favorites list,
Obviously,
so
if
you
it
can build your own
doesn't, you know
personal
your body
library.
best whether
And
you
the
should
thing
be
that's
doing this work
there's
or
two
not.
things that are
But
beautiful.
if it does
One
not feel good,
is
don't do it.
you
It's
can
not something your
add
body
to the
likes. But
library.
I
There's a
do really
simple
love
like
this one.
plus
This one
sign at the
was the
top of the
very first thing
screen,
that
and
helped me
you just
start to
add it.
wake
You
up
put the
my
name of the
core
article, the
through my
URL,
injury. Is
and
I was
medical
able to
review
lay
board.
down
Make sure that it's
and feel
credible.
supported with those
So
knees
it's a
bent and
trusted
feet flat on the
resource.
floor.
And
Again,
the
my
second
hands are
one
down
is,
by my
and
side
this will
here
develop more in time because we
and
just launched it
able
a
to
few months
support me.
ago,
If I ever feel
is the
wiggly
ability to
throughout,
upvote.
my palms of
So
my
say, for
hands
example,
are
I found
down on the
something really
mat
helpful, and so I
or
kind
on
of
the
gave it
floor,
a,
wherever
like
you
a
are,
heart
to
or,
stabilize
whatever.
you.
I gave it a check.
So
And the more
So
people that
that
give
is
that
zip
item the
up,
check, the
exhale,
more it's
belly,
gonna cream's gonna
or
rise to the top.
just
And
deep
so
breathing.
there'll be sort of
Breathing
a
and Pilates
secondary
is what we call
system
it as
of
well.
where, based on
And
patient
making sure that you
input,
slow it down and
it
count to
will
5 with
have the
each
most
inhale
valuable
and
information rise
exhale
to the top
is
over time.
how you
So
start to
take advantage of
feel
that
those layers
resource.
of our abdominals
It is, I
starting
have a
to wake
question in
up
the
and
chat. It is
engage. Now, the next exercise where we're also using this deep breath work
eds411.com.
is in cat-cow.
It's free.
I'm sure
So
many of
use
you
it, share
are
it.
very familiar with this exercise.
There's my plug
But
for some of the stuff
sometimes
that I've
we
been working
move
with some
through it
people
very
on.
quickly and we're not getting the most
So
impact
before we
out of
hang
it
up,
and allowing our
for
body to
anybody watching
slowly
today or
stretch
watching
through,
later, how can
using
they
those
connect with you,
abdominals to
Jonathan,
stabilize us
or
while we're
get
in
in
that
touch with
position.
PARR PPT or
Now,
learn
this
about,
position we're in
some of these
quadruped, which
virtual
means
things
that
that you're
we
doing?
are
What's
on
the
our
best way to
hands
reach you?
and knees.
Yeah, you can
So
go to our
making sure
website.
that you
It's
feel comfortable in this position.
www.PARR, so
If you do really struggle with stability right now,
PARRPT.com.
making sure that someone is
And
at
PARR
home with
PT
you
is
while you
on
do these
YouTube,
exercises,
on
I do highly recommend if that's
Facebook, on
possible.
Instagram, where we have some informative videos.
Making sure, so I will get in
We've been putting a lot
quadruped
more up
position.
on various conditions
Christy,
and
are we good
questions
here
and
with what
those
you
kind
can
of things. So
see?
anything along that PARR PT platform there,
Yes.
whichever one they choose to
Okay,
do,
thank
can
you.
search for
Good.
us.
So make sure you
And if
see
they
that
wanted
my
to like
hands are
schedule a
directly
virtual
underneath my
appointment, are you
shoulders.
taking that? Like,
That's
how
really
does it work
important.
when,
And our,
Well,
my
if you go
fingertips
to the
are
website
long,
and you go to the
facing that
contact and
way.
scheduling and
We
fill
don't
out the
ever want to
inquiry,
feel
just
stretched
give a
out
little
like
bit of your
this, or
information on
have
what
our
you're looking
hands
for,
too
and it
underneath of
paints
us.
a better picture.
That way,
That way
do
we're
you
able to
see
get you
where that
scheduled
angle is happening?
and get you
That's
going.
putting way too much stress on the
fantastic.
shoulders.
All
So
right. Well,
really
I know
making
I'm
sure we
personally
have that
grateful
straight line,
for all of
shoulders
your
right
time
underneath wrists.
and,
Good.
you know,
And
having
then
these sorts of
keeping our
showcase
knees,
good
I like a
stories for
wider
good
stance to my knees.
therapies that are
So
working
my
to be
knees
able
are
to share
about
in the EDS community
4
makes me
inches,
feel more empowered
4
and
to 6
hopeful.
inches
So thank you
apart.
so much,
So you
Jonathan, for
don't
being
have
here
this
with us and
narrow
all
base
of you
like
for
this.
joining.
My
I hope
legs
you have
are
a great
wide, so I
evening
feel nice
and
and
a great rest of
stable.
the year.
That'll make you feel
And we'll see
safe
you
in this
soon, I hope.
position so
Yes.
that you're
See
not
you soon. Thank you, everyone.
wiggling
Thank
around,
you.
especially if being in this position is hard enough. So again, remembering your body and really thinking about, is this a good position for me to give this exercise a try? You know best. So we're going to count to 5 once again. That's kind of the key number, is to slow us down. We've all done the cat-cow that looks like this. Well, we're kind of freaking our body out because we're pulling it here in our back, because we're not giving our spine a chance to round and then expand. So let's take that count of 5. Let's slow it down for our body and really allow it to feel the stretch, and also allow our abdominal muscles to support us through the stretch. So we're going to take that deep inhale. 5, 4, 3, 2, 1. And exhale. 5, 4, 3, 2, 1. Now, it's always typically in the exhale where we find ourselves to rush a little bit more. So I really encourage you to just count it out loud or in your head. That's what I still do to this day to keep me on track. We're always in a rush, it seems like, in life these days. So just slowing this down and really trying to visualize each layer of our abdominals starting to turn on, to fire and engage here. So as you inhale, 5, 4, 3, 2, 1, enjoy this gentle stretch through that low back. And as you exhale, gently, 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 slowly come down into cow, lifting the head as much as it feels comfortable for you. And while you lift the head and have it up in this position, also think about your shoulder blades coming back and down, relaxing back and down. We can get so into our shoulders these days with cell phones and laptops and all the work that we do with our technology. But so slowing it down, really getting the most impact out of this move and thinking about how our whole body is being used here. So as we inhale, rounding, 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 rounding. Slowly exhale, releasing so gently. It's like vertebrae by vertebrae are gently being released, dropping the shoulders back and down gently, never adding force here, and just feeling this beautiful stretch. It's a very controlled pace as we go through this. And deep exhale. Okay, so with that one, really taking your time with it, feeling all the muscles that move. After you do about 3 of those, you really will feel your core working again. It's a slow approach, and sometimes for me, and I see this with my clients as well, it begins with maybe they don't know exactly what they're feeling, but they begin to have the awareness of like, oh, this is moving. This is supporting me. I feel that it's starting to turn on and to fire and to engage in the right ways. This area of our body is, I almost call it the nucleus of our body, because it supports us through everything. It supports our back. It supports our glutes. If we have a strong core, then our shoulders can drop down. Our posture changes. And if we can stand and sit and be able to support our body, our alignment changes and goes into the ways that we are supposed to be aligned. And that ultimately makes us feel better. If everything's in the right place, our body can start to function at a higher level and feel stronger. So take your time with this. Slow and steady is always the approach here. Now, our last one is a seated position. So really be thoughtful of, is this good for me to do? This
Caroline,
one- yes,
Ashton has a question, if you don't mind answering that before you go on.
absolutely. Hey,
I wasn't sure if I should just wait. So I just thanks for saying
No.
something. So I guess I was wondering if there's like a version of that exercise that doesn't require you to be on your hands and knees.
okay. So tell me what positions feel good for your body right now.
Sitting or laying down.
Okay.
Um,
Okay. So you can sit upright.
mhm.
Awesome. Okay. That is fabulous. So actually the next exercise is going to be perfect for you then.
Cool.
Because we'll be seated. But another way that you could do that actually, and it's being mimicked in the first exercise that I was showing you. But if we're going to lay down here, just like we were, so you can actually go into it lying down. So let's do this together. Can you see me okay?
Mm-hmm.
Okay, so just like cat cow. Okay, so what we're gonna do, we're gonna do cat where I'm gonna round, which means lying down, flipping that around, where that means I'm going to expand out of our belly here. So I'm gonna bring my hands here again so you can see. So inhale and feel the shoulders start to relax here. So you'll do that for a count of 5. And as you exhale, you can gently now over exaggerate more than we did in that first exercise. So now you will slightly pull more into the exhale, even deeper, so that you get that spinal decompression / stretch there in this low back tailbone area. So we'll do it again. So you'll inhale, expand, really open up, feel like the shoulders are dropping back. You're lifting off the mat. I don't know if you can see my hand, but I'm actually arched off the mat here. So, and then exhale, pulling my low back very gently into the mat using my breath. So you'll just over exaggerate it and actually allow your spine to lift and arch. So then as you exhale, you'll bring the spine down, melting it into the mat. You will get more of that spinal stretch and movement there. Does that make sense?
Yeah, that makes sense.
Okay. Does that feel like something your body might be okay with?
Yeah, I was also asking on the behalf of a friend.
Oh, wonderful. Wonderful. Yeah. That's the beauty of one of the things that why I have such a passion for Pilates and I love sharing it with people is it's often very discouraging as we want to get back into movement, but our bodies have gone through and are continuing to go through so much that we can tailor it just to you. We can really bring in the range of motion. We can slow it down. We can find a way for pretty much almost all bodies to be able to get some of this movement and this core engagement to happen. So it can be as supportive or unsupportive and challenging as we need it to be. And as you grow stronger, we can move it forward. But yes, it is very, very gentle. So hopefully that will help your friend. And obviously, Chrissy will have my information too. But if you have any additional questions, feel free to reach out. Happy to brainstorm and help.
Thank you.
Oh, you're so welcome. You're so welcome. Okay. So this next one, which will be helpful for you as well, is a seated postural position. So I'm going to kind of show you shoulders, head, things like that are moving. So it's a little bit hard to show this from the side. So what's really important here is as we sit, it's unbelievable how much we're using our core to actually hold ourselves up, where our shoulder blades are in line with our glutes underneath of us, and we're not leaning back. We're not rounding forward, right? Those are often ways that we can, our body finds to compromise for us when we have a really weak core, and holding ourselves up is just very, very difficult. And that's why when all of this starts to happen, the lean back and the round forward, other things start to get out of alignment, and that can truly cause more pain in other areas. So by being able to begin to engage our core in a seated position with our breath in this gentle way, it's going to be wonderful. So we're going to take a deep breath in here. Again, breath is the key with all of these exercises. I encourage you to sit on a chair or a sofa, whatever feels comfortable. I just would avoid any type of furniture that is really squishy, that compacts, and where you're going to have to really hold yourself up and it feels unstable underneath of you. A firmer surface is what I suggest for this. So if we're seated, we have our light touch of our fingertips. Our hands are not pushed down onto the mat. It's just our fingertips touching the mat. Because if we're pushing ourselves down, you immediately see what happens. I sink down in my core. My back is being pulled down from the back. And now my shoulders are really feeling tight and like I'm forcing it downward. So if we have this light touch here, automatically I start to lift up to do that, because it's only my fingertips touching the mat, and they're just like that. And we're going to take a nice inhale. And as we inhale, think grow tall out of the crown of our head, lifting out of the waist with our inhale of our breath. And as we exhale, like that wave again, we're keeping the lift out of the waist. We're allowing our shoulder blades to gently drop down, but we're staying lifted. We're using our core here. So as I exhale, you won't see me go. A lot of times that's what we do. And each exhale, we actually are slumping into our spine and our back. So I'm going to raise this just a little bit so we can see a little bit more of my head. So just to show you my shoulders and my head here, we're going to take a deep breath in. As I lift, 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 lift. And as you exhale, like that wave flowing down, bringing the body back into, bringing the abdominals back into the body with that deep exhale, feeling that oppositional pull of shoulder blades coming back and down while still feeling lifted out of the waist. So first of all, this is going to feel really nice on your shoulders. If you find yourself very pulled forward like this, it's going to feel like a nice stretch, and it will feel like your shoulders are coming back into your body. If you're feeling that oppositional pull that we're looking for. Also, making sure before you begin that you're underneath yourself and you're on your sit bones. So really sitting on top of your sit bones and feeling lifted out of the waist. So we'll do that again. So that deep belly inhale, growing out of the crown of our head, feeling like a string is almost pulling our head up, 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 lifting out of our waist. Now with that exhale, you'll see that I continue to stay lifted, and that's where we're using our core and engaging those muscles. Deep exhale here for 5, 4, 3, 2, 1. Still continuing to have that lift. This is the exercise you'll feel your abdominals turn on the quickest. Because you're seated, you're already holding yourselves up. You're already working your core by just sitting like this, let alone engaging it with that deep belly breath in, lifting up out of the crown of the waist, lifting here, and exhale while still maintaining that lift, bringing that core in, your core muscles are nice and zipped up and you're holding yourself up. For me, when I started doing this, that was a brand new feeling. I was so pulled forward by using walking canes for so long that I didn't know what this was anymore. That I had muscles here, and I had to be really, really careful with my back of how do I begin to engage them. And these are the most gentle ways that I personally have found. And I still have my own setbacks and to these days. And when I need to bring it back down to the foundation, these are the exercises I take my body through to begin to not only feel a nice stretch, but to wake up those core muscles. So just after those those reps that I did, I feel my core. So it's going to be an excellent way, if your body allows, for you to gently begin to feel those muscles again and strengthen them. And the more you get comfortable with that, the more you can start to build up. But it's so important just to start to ask your body to grow stronger here through our breath, gently and a really kind approach. Our bodies have been through so much. So constantly, if we can take care of them and be slow as we ask it to step into this new role, it's really, really the best approach. So those are the 3 exercises I wanted to take you all through. I'm happy to answer any questions. I also, Chrissy will have a one-sheeter that will explain each exercise and really go through the steps that I did so that you can constantly refer back to it. I know this is a lot to take in all at once. And if you choose to try any of these for yourself, I know it'll be nice to reference a one-sheeter and be able to really look at that as you're in that moment doing it. So I hope you find that helpful. And yes, I'm here to answer any questions that you all might have. Again, always consult your doctor or medical provider. These are my suggestions. They personally help me, and I see them help my clients. But at the end of the day, you know your body best, and really what feels good for your body right now.
And I will put the, as she mentioned, the one-sheeter, the foundational core engagement exercises in the folder with the presentation. So they'll be there together. And I can turn off the recording if anybody has any additional questions. Hold on just a second. Let me figure out